So March is Endometriosis Awareness Month, and so we put a spotlight on this disease. It's a disease that commonly impacts 1 in 8 women and young girls with extreme pelvic pain. Shauna Fuller-Clark is the co-founder and executive director of Better Awareness and Support for Endometriosis BASE Foundation. Dr. Michelle Bailey, consultant OB/GYN. Ladies, good morning, and thank you for being here with us this morning.
Good morning.
Sean, I'm going to start with you because you started the BASE Foundation. Give me the catalyst for why you started it.
Well, I was diagnosed with endometriosis and I did not find any support in Jamaica. I was not able to get information readily. And based on my experiences, collapsed lung, 8 years of symptoms, going to 5 doctors and not getting the help, I knew that there was a gap that needed to be filled. And for that reason, my mom, my husband, and I said, you know what, let's start this foundation because there must be other girls and women like myself who were going through this.
Did you say collapsed lung?
Yes, ma'am.
From endometriosis?
From endometriosis, I mean, you're going to get to doc, but one of the things that was so startling for me is that the tissue can go to any organ in your body. And unfortunately, the tissue from endometriosis went straight up to my diaphragm and ended up causing a collapsed lung where they had to take 4 liters of liquid from my chest.
Dr. Bailey?
Yes.
Something can really go so?
Yes, that's so true. It's very unfortunate, but that's really what happens.
Because when we think of endometriosis, right, those of us who know a little bit or think we know a little bit about it, we think about, reproductive organs and we think about intense belly pain, but my goodness, I have a collapsed lung as a result.
Yes. So generally, the lesions are in the pelvis, but it can really go anywhere in the body. And they've actually found a few cases in the brain. Yes.
Mm-hmm. Okay, so let's reverse back, as Jamaicans would say. We're talking about lesions. You said lesions. Talk to me about what endometriosis is.
Okay, so essentially it's where the lining of the womb or the endometrium tissue that's similar to that tissue is present elsewhere or outside of the womb. So it can be, typically it's on the ovaries, it can be on the bowel, it can be on the uterus itself, but in very rare occasions, as Shauna mentioned, it can be seen in the lung, it can cause collapsed lung, and as I mentioned before, there are a few cases that have actually been detected in the brain.
Wow. And how easy is it to detect? Because I get the feeling that there are some women, Shauna mentioned, who will walk around with this disease for a while and don't know because it manifests, 1, in different ways, and 2, because we have periods. And some of us just think that maybe it's a heavy period and it's just bad cramps and it's heavy bleeding. And we don't go and do the necessary checks until it just becomes unbearable. Shauna, was this your situation?
Look, I didn't even have painful cramps when I was younger. My symptoms were severe bloating, shortness of breath, and being misdiagnosed with asthma, being told that it's normal, until I had this very unfortunate and traumatic situation where I couldn't breathe and I had to be in the hospital for several days. So a lot of women go through this, and it's not easy. It's a very difficult road to traverse because first, painful cramps or pain and discomfort is normalized as something like a woman's load to bear when it is not.
It is not. That's a powerful, powerful statement to make. Shauna, how are you now? How have you dealt with it?
It hasn't been easy. To be honest, it's been one of the most difficult things I've ever had to do in my life. Because of the pain you go through, because of, thankfully, I have support through my husband, through my family, through my friends. But just the mental fortitude, especially with us running a foundation and supporting the women, it's not easy, but I'm in a much better place because I've gone through a whole slew of treatment options And I think I found something that's working for me. So in terms of pain, it's not as bad as how it used to be, but it's something that I have to live with because there's no cure.
Yeah, so that's what I wanted to ask you, Doc. So Shauna has been going through this for a long time. You'd hope that once detected, there's something that can be done about it, but I mean, relatively her pain is better, but she's still feeling pain. And I've read this, the pain can be incapacitating, like you can't move, you can't go work, you can't think straight. And this is also the leading cause of infertility. Is that true, Doc?
It's one of the main causes of infertility. And that's another presentation. So as Shauna said, she didn't have the typical presentation, which is, very painful periods, usually stopping you from going to work or school. You may also have pain just before the onset of the period, and you'll have pain during sexual intercourse. But when those are the typical symptoms, but 25% of patients have no symptoms at all. And those are the patients who just present with difficulty getting pregnant. The unfortunate thing for this disease is that it takes a long time to be diagnosed, on average about 7 to 10 years, because remember, endometriosis can actually start from your first period. So the longer it takes to be diagnosed is the more damage it can cause along the way. So really and truly, early diagnosis and intervention is going to be critical to prevent some of the complications that Shauna had.
And about treatment now, because Sean's mentioned there's no cure, but how do you, I mean, this affects your quality of life, your mental health, your physical health. How do you, after being diagnosed, try to live as normal a life as possible?
Boy, Simone, you just have to make up your mind and do it. I just decided based on my brush with that serious health issue that I was going to live my life, the best life that I could lead, right? So every time I was well enough, I would do something I enjoy doing, but I learned how to cope with it I'm always walking with my pain medication. I always walk with my pain medication. My doctors are on speed dial. My friends know of my situation. So I remember even going to a party and I started getting an endo flare up, and the husband just knows that I have to drop your chair and come over and sit down, and I had to take my medication. And after a while, I would have been fine. But you learn. But you pull on people. Support is so important.
Which is why base is so important. Doc, what about treatment options? Shauna mentioned painkillers. What else?
So generally we start with painkillers, usually anti-inflammatory, because endometriosis is an inflammatory disease, right? So things like your ibuprofen, that's like Advil, or like naproxen sodium, like Aleve. So typically we start with that. And if the patient has good symptomatic relief, then we may just keep them on that cyclically. So every time she has her period, then we say, you start the medication about 2 days before you expect the bleeding, and you just take those medications throughout the period. That, however, may not be sufficient, and usually we have to use hormonal therapy, and that could include the use of the birth control pills, or we may use progesterone-only supplementation, such as Depo-Provera, right? And then we have another drug that basically shuts down the axis that is responsible for the production of estrogen, because one of the things with endometriosis is that it responds to estrogen, right? And we produce estrogen. So basically the hormonal therapy is to try and reduce the amount of estrogen that is produced, right? So if medical management has failed, which includes your painkillers or your hormonal therapy, then the next step would be for us to entertain the conversation of doing surgery. And the best surgery for endometriosis would be laparoscopic surgery. That's like the keyhole surgery. It's a minimally invasive procedure. But that really is the best surgical approach, because we get to see the entire abdomen clearly, and we're able to actually remove the endometriosis deposits that we see. And sometimes they're not, which are basically the large collection of endometriosis that we can remove.
Okay, ladies, we have to go. Shauna, my heart goes out to you. I mean, I've had cramps, and if I can't even imagine. I can't even imagine. I won't tell you. I understand. I can't even imagine what you and those women in Jamaica and across the world who have this disease go through. My colleague Dion Jackson Miller has spoken openly about her battle with it. And you are brave for speaking, and I'm hoping ladies who are watching this morning who are going through the same issues or may detect some of the symptoms you mentioned will go and check your OBGYN so you can find out if you can get some relief from this. BASE is the foundation, the support group. Tell us quickly, we have to go, Shauna, where do we find you?
Find us on Instagram, Facebook, Twitter at Base Jamaica. Base Jamaica website, basejamaica.com. Phone number 810-2273.
God bless you. In her own grief and trauma, she's helping other people. Bless you, Shauna. Thank you, Doc, consultant OBGYN,
You're welcome.
Dr. Michelle Bailey, and co-founder of executive director of BASE, the BASE Foundation, Better Awareness and Support for Endometriosis, Shauna Fuller. When we come back from this break,